Hi, my name is Eric Landeros and my presentation will be about drugs. Why do people do drugs? Well, one of the reasons that people do drugs is because they produce intense feelings of pleasure. Another reason that some people start using drugs would be because they want to feel better. For example, people who suffer from stress-related disorders might use drugs because it helps them calm down. Also, they start using drugs because of curiosity. They're curious to know how it feels to use drugs and, well, they see everyone else doing it. Using too large doses of any drug regularly can lead to drug addiction. What environmental factors increase the risk of addiction? Parents or other family members who abuse drugs or engage in criminal behavior increase the chances that their children will become drug addicts. One of the reasons they start using drugs is because of peer pressure. They see their friends using drugs and they start doing the same thing just to look cool. Young people are at higher risk of doing drugs because they are still not able to make good decisions, they are easier to manipulate, and they're stupid. Drug addiction increases the risk of dropout among teenagers. The most commonly abused drugs are cannabis, cocaine, methamphetamine, and hallucinogens. Cannabis is a tobacco-like greenish or brownish material that is made up of the dried flowering tops and leaves of the cannabis plant. Short-term effects of cannabis use include an increasing appetite and pulse rate. Cannabis can also be used for medical purposes, but some people use more than the amount they are supposed to use, or they use it only for pleasure. According to the most recent nationally representative survey of US high school students, by 10th grade, 33% of young people have tried cigarette smoking, 58% have tried drinking, and 37% at least one illegal drug, which is usually marijuana. Now, people who use large doses of cannabis may experience severely altered sensory perceptions and slow and confused thinking. Also, if the dose is very large, the effects of cannabis are similar to those of hallucinogens, and they may cause anxiety, panic, or even psychotic episodes. Now, what is methamphetamine? Methamphetamine is part of the group of drugs called amphetamine-type stimulants. It is a synthetic drug that is usually manufactured in illegal laboratories, like in Breaking Bad. Methamphetamine comes as a powder, tablet, or as crystals that look like little pieces of glass. Methamphetamine can be swallowed, snorted, smoked, or injected, but it is usually snorted. And like cocaine users, methamphetamine users also experience a rise in energy that is often perceived to improve their performance at intellectual tasks. And they also experience a loss in appetite and fatigue. Short-term users of methamphetamine may experience faster breathing, and their heart rate and blood pressure may increase, and the body temperature may go up and cause sweating. With large doses, methamphetamine users may feel restless and irritable, and they may experience panic attacks. Also, methamphetamine use sometimes triggers aggressive and violent behavior among users. Most people nowadays know how to make homemade bombs like this one. Of course, mine is pretty shitty, but it still works, I'm assuming. And it is really easy to make one of these, and this is how it works. You just put the weed here, and you're gonna need a lighter or matches. Nobody uses matches, I'm assuming. And when you light it, and you start smoking. People also use apples as bongs, and I was gonna make one so I could show you how it works, but my brother ate the last one. Cocaine is a white powder that acts as a powerful stimulant. Cocaine users experience feelings of power, self-confidence, and increased energy. Short-term effects of cocaine use include faster breathing and increases in body temperature and heart rate. Excessive doses of cocaine can lead to seizures, stroke, cerebral hemorrhage, or heart failure. There is also a drug called desmorphine, but it's mostly known as crocodile, and it is extremely dangerous. A side effect of this drug is that it starts eating your skin. Now let's move on to physical and psychological damages of using drugs. There are many ways that drugs can harm you physically. Drugs affect many parts of your body, including liver, lungs, heart, and kidneys, and many other organs. Some psychological effects of drugs are paranoia, anxiety, hallucinations, confusion, and depression. People with drug addiction start losing interest in activities that they love to do, and also they lose interest in their relationships with their families and friends. For some drug addicts, their drug addiction goes to an extreme level that they don't care if they lose everything they have, as long as they keep using drugs. Now I want to talk about using drugs during pregnancy. Nearly 4% of US pregnant women use highly addictive, mood-altering drugs such as cocaine or heroin. Using drugs during pregnancy increases the risk of stillbirth, miscarriage, low birth weight, premature birth, and sudden death syndrome. Using drugs during pregnancy also can lead to birth defects. The chances that the baby from a pregnant, drug-addicted mother also develops a drug addiction is high. Now I want to show you a video about the effects of drug use during pregnancy.
It is a crisis. It is epidemic. The opioid crisis in this country is continuing to expand exponentially, and we're seeing more and more of these infants.
Like, I was in labor, in the bathroom shooting heroin, about to give birth to my child.
The fact that the baby is born addicted to drugs should be a big red flashing light that says, danger. Let's all, take a look at this child and its mother and its family and its residents and see if it's safe.
You're so clouded when you're using, and when you're an addict, you think everything you're doing is okay, you're not doing anything wrong.
How can there be pregnant women so irresponsible that they don't realize that they're not only harming themselves, but they're also harming their babies? Luckily, there are some treatments to cure drug addiction, but overcoming an addiction is not that easy. Most people need long-term care to stop using drugs completely and move on with their lives. Most people who are able to successfully quit drugs have a relapse after a couple months, but eventually they're able to overcome their addiction. Interventions are also a great way to treat people with a drug addiction. During interventions, friends or relatives of the person with the drug addiction try to illustrate how his addiction is affecting him. Because drug addiction is a chronic disease, people can't just stop using drugs for a few days and be cured. There are also some programs that are designed to prevent drug addiction among teenagers. Programs that teach at-risk teenagers effective strategies for handling life stressors and that build competence through community service, reduce alcohol and drug abuse, just as they reduce teenage pregnancy. The best way to prevent drug addiction would be to be more aware of the horrible outcomes that it can bring to your life. The more a person uses drugs, the more they will depend on them. Well, now you know a little bit more about the consequences of using drugs. So be more careful about the decisions you make and don't do drugs. No, wait. Stay away from, whatever.